Welcome to section 1 of reproductive pathology. In this section, we'll be discussing the pathology related to the penis. Let's get started. Here's our overview slide. Let's begin by discussing Peyronie disease. Peyronie disease means an abnormal curvature of the penis. The curvature can be very small or very large and can curve in any direction. It's caused by plaque formation in the tunica albuginea. The most common way a plaque forms is by trauma, such as during sex. Some patients' only symptom may be curvature with erection. However, others may have erectile dysfunction, pain with erections, and anxiety and stress about the deformity. There are a few ways to treat it. One is with manual traction. There are various devices on the market that a patient can use for this. Another option for treatment is a collagenase injection. The theory is that the collagenase breaks up the plaque. The final option is surgery, where the curvature is corrected. The choice of treatment depends upon each individual patient's symptoms and concerns about the curve and degree of curvature. All right, let's review penile anatomy to understand why a plaque would cause curvature. This is a cross-section showing the anatomy of the penis. Take a look at line number 5, which highlights the tunica albuginea. This is a layer that surrounds the corpus cavernosum, also called the corporal or erectile body. During erection, the corpus cavernosum fills with blood to cause rigidity. And as we just discussed, Peyronie disease is caused by a plaque in the tunica albuginea. So hopefully this should make sense why a plaque in this region that surrounds the erectile body would cause a curvature. Here is a coronal ultrasound of the penis. The image on the top shows the normal anatomy, and take particular notice of the tunica albuginea surrounding the corpus cavernosa. There are no plaques or masses in this image. Now, if we look at the image on the bottom, we can see that the blue arrows are pointing towards a plaque in the tunica albuginea. The plaque can be seen right here. This plaque is what causes the penile curvature. Here's an image showing a patient with Peyronie disease. As you can see, the penis has a downward curvature when erect. This is only one variation of Peyronie disease. Again, the angle of curvature can be smaller or bigger than this, and the direction of the curvature can also vary. All right, let's move on to discuss priapism. Priapism means a persistent erection. It's not associated with sexual stimulation and lasts at least 4 hours. Ischemic priapism specifically means that the erection is caused by low blood flow. The main causes of ischemic priapism are sickle cell disease and medications, such as sildenafil and trazodone. Sickle cell disease can cause ischemic priapism when sickled cells block the vasculature in the penis. The main symptom is severe pain with an erect, rigid penis. Treatment includes corporal aspiration, intracorporeal injection, and if those fail, then the patient needs emergent surgery. Corporal aspiration means that a needle is placed into the corporal bodies and some stagnant blood is aspirated. You can also give an intracorporeal injection directly into the corporal bodies. We use a sympathomimetic called phenylephrine. Recall that phenylephrine is a selective alpha agonist. It causes blood vessels to constrict, and this helps treat ischemic priapism. This is again a cross-section of the penis, which shows the anatomy. Again, here's the corpus cavernosum. The corporal bodies are what fill with blood to cause an erection. In treating ischemic priapism, aspiration or injection of phenylephrine would happen in the corporal body, which again is just another name for the corpus cavernosum. If these fail, a shunt is made that helps the corporal body drain blood. How the shunt works is beyond the scope of this lecture. All right, let's move on to discuss our last topic, which is penile cancer. Cancer of the penis is rare, but is most commonly caused by squamous cell carcinoma. It may be preceded by precancerous lesions that can be treated if caught early. There are a few risk factors, one being uncircumcised. Another is high-risk HPV infection, specifically strains 16 and 18. Although HPV more often causes head and neck cancers in men, it can contribute to penile cancer in some cases. Luckily, these strains are included in the HPV vaccine. Finally, treatment for penile cancer is surgical removal with penectomy. All right, now that we've covered the information, let's review with a question. A 17-year-old male presents to the emergency room complaining of an erection that has lasted 4 hours and is associated with severe pain. He has a known history of sickle cell disease. Physical exam reveals a rigid phallus that is exquisitely tender to touch without deformity. Which of the following is the most appropriate next step? A. Emergency surgery. B. Intracorporeal injection of phenylephrine. C. Intracorporeal injection of epinephrine. D. Intracorporeal injection of saline. Or E. Observation. All right, this is a 17-year-old male presenting with a painful sustained erection lasting more than 4 hours. He also has a known history of sickle cell disease, which should raise your concern for ischemic priapism. His physical exam is consistent with this, and there are no signs of trauma or penile fracture. So the most appropriate next step is intracorporeal injection of a sympathomimetic drug, specifically phenylephrine. So the correct answer is B. Recall that phenylephrine is the drug of choice because it is relatively specific for alpha receptors, which minimizes side effect risk. A is incorrect because surgery is only the treatment of choice after failure of aspiration and intracorporeal injection. C is incorrect because epinephrine is not the drug of choice, it's phenylephrine. And D is incorrect because saline would not be therapeutic. Finally, E is incorrect because priapism without treatment causes irreversible penile damage. So again, the correct answer is B. And that concludes this section.